Shopping for healthcare simply doesn't work. So what might? The new healthcare, it's often too complicated. And even when it isn't, almost no one does it. Image on the way to their MRIs, patients drive by an average of 6 other places where the procedure could have been done more cheaply, a study suggests. Credit quality for the New York Times each year. For well over a decade, more people have faced higher health insurance deductibles. The theory goes like this: the more of your own money that you have to spend on health care, the more careful you will be, buying only necessary care, purging waste from the system. But that theory doesn't fully mesh with reality. High deductibles aren't working as intended. A body of research, including randomized studies, shows that people do in fact cut back on care when they have to spend more for it. The problem is that they don't cut only wasteful care. They also forego the necessary kind. This, too, is well documented, including with randomized studies. People don't know what care they need, which is why they consult doctors. There's nothing inherently wrong with relying on doctors for medical advice. They're trained experts, after all. But it runs counter to the growing trend to encourage people to make their own judgments about which care, at what level of quality, is worth the price. In other words, to shop for care. Shopping for health care may sound ludicrous on its face, and sometimes is. People don't have time, let alone the cognitive focus, to shop for treatments while having a heart attack, or during any other emergency. But not all care we need is related to an emergency. Some care is elective, and so potentially shoppable. Scholars have estimated that as much as 30 or 40% of care falls into this category. It includes things like elective joint replacements and routine checkups. And yet very few people shop for this type of care, even when they're on the hook for the bill. Maybe it's just too complex. Even when price transparency tools are offered to consumers to make it easier, almost nobody uses them. A National Bureau of Economic Research working paper published Monday adds a lot more to the story. The study team from Yale, Harvard and Columbia considered a healthcare service that should be among the easiest to shop for. Non-emergency, outpatient, lower limb MRIs. This is the kind of imaging you might get if you're having some trouble with a knee or ankle. But not bad enough to need the image right away. The study, which focused on more than 50,000 adults between 19 and 64, strongly suggests that people get their MRIs wherever their doctors advise, with little regard to price.